Hello and welcome to Seminary to Dragon's Health. Today we had the pleasure of speaking with Dr. Sarah Nechuta. Dr. Sarah Nechuta is an associate professor in the Master of Public Health program at Grand Valley State University, where she has earned a reputation as a dedicated educator, mentor, and researcher. With a PhD in epidemiology from Michigan State University and an MPH from the University of Michigan, Dr. Nechuta has established herself as a leader in cancer epidemiology, particularly breast cancer survivorship, perinatal epidemiology, and women's health. Dr. Nechuta's work spans a broad spectrum of public health research, including large-scale cohort studies, data linkage studies, and epidemiological methods. She has published over 50 peer-reviewed papers and serves as editor of the Michigan Journal of Public Health and associate editor for the Journal of the National Cancer Institute. In addition to her research, she has been recognized with numerous teaching and mentorship awards, reflecting her commitment to guiding the next generation of public health professionals. Her contributions to the field extend beyond academia, as she plays an active leadership role as the membership and event chair of the Cancer Forum at the American Public Health Association, APHA, and the Michigan Public Health Association. Welcome to this interview, Dr. Sarah Nechuta. We are indeed honored to have you with us today.
Thank you so much. I appreciate the introduction. I'm very honored to be here as well.
Dr. Nechuta, can you share your journey into public health and what inspired you to pursue an MPH and a PhD in the field?
Yes. So my journey into public health is probably similar to many others in that I started out pre-med in my undergraduate degree. And I was, after volunteering in the emergency room and also in a clinic, I kind of started to realize that that career wasn't right for me. And I actually had the opportunity to participate as a research assistant for the first time on a study of infant and maternal health. It was a study of mothers in rural Michigan who were first-time mothers and teenage mothers, and who are also living at home and looking at the different emotional aspects as well as social support between mothers, infants, and the grandmothers involved. And so that really introduced me to the area of maternal and infant health. I also have always had a strong interest in reproductive health and women's health. And so I started to look for a new career path that I would be interested in, and that led me to doing my Master's of Public Health at the University of Michigan. And during my time at the University of Michigan, I wanted to participate in the maternal and child health concentration, which I was really interested in, but I had to fund my degree. And so I had to find jobs that would work for me. So the research opportunities I was able to obtain were actually in chronic disease. And as I started to look into work in those different areas, one area that I got exposed to for the first time was breast cancer research from one of those positions during my MPH degree. And I had the opportunity to work on a study looking at reproductive factors and breast cancer risk with my mentor at the University of Michigan. And that really started my interest in breast cancer. At about the same time, a very close family member was diagnosed with breast cancer. And so I was experiencing this personal experience as well as this experience in my Master's of Public Health education. And that really cemented my interest in breast cancer research. I was able to, for my PhD, combine that breast cancer research interest with also my continued interest in perinatal health to do a perinatal epidemiology fellowship for my PhD. That was a great opportunity for training and education in both perinatal health as well as breast cancer research, and really getting a lot of good experience in applied epidemiology and research experiences. So for my PhD dissertation, my research was focused on perinatal factors and breast cancer risk in Michigan. That also introduced me to the role of data science in population health, as I did a data linkage study. Thinking about accurate methods and epidemiologic approaches is really a passion of mine, but also using that information to get important insights to answer important questions. So that really provided a great experience for me.
Thank you for sharing your journey into public health. As an associate professor in the Master of Public Health program at Grand Valley State University, what have been the highlights of your successes and challenges?
I think a big challenge really, because I've been there since 2019. So as you can imagine, teaching during the pandemic, that kind of transition from, because we have an in-person program, we also have an online program, but at the time we were largely in person. So that transition from teaching in person and mentoring in person to suddenly being online, to be able to still provide a high quality educational experience, to be flexible for students and provide support, while also myself learning how to transition to online teaching live via Zoom. All of those different components were tricky. However, I feel that coming out of that, we really have learned how to be more responsive and flexible in our educational strategies. And really, I feel that's helped in regards to just being able to offer different options. Now I can meet mentees via Zoom and in person and, use different approaches that maybe weren't as common before that. And so I think that there was benefits to that as well, though it was a tricky time at the start. Another challenge probably that just faces anyone that's, working in academia is just balancing teaching and education with service commitments and scholarship commitments, and finding time in the day to fit in everything you'd like to do. So that's really kind of the main challenges. In regards to successes, I think my biggest success has been to have the opportunity to be an educator and mentor to graduate level students in epidemiology and public health science, and really seeing student successes, for example, something like submitting an abstract and presenting at a local conference or a national conference, or having the opportunity to have a leadership position in a local public health association, or also supporting opportunity for scientific publication. Those kind of opportunities are really the biggest successes for me personally. Another big success is being able to develop my service role in the Michigan Public Health Association, and really finding a new network of public health professionals that are committed to public health in Michigan, and providing educational opportunities and training opportunities, career development opportunities, and building that community, and then connecting that back to my role at GVSU.
Wonderful. As the membership and event chair of the Cancer Forum at APHA, what have been your most significant achievements in this role?
Yes, so I am new to that role this year. So it has been a year of learning, meeting new colleagues, and kind of starting some new goals and plans. So our key goal, and I actually have a co-chair for the membership and events committee, who is Khushbu Balsara, and she's my excellent co-chair. So our main goal was to provide some educational and career development opportunities for the Cancer Forum through offering webinars that were recorded, and then also one focus on career development, and then one focus on promoting examples of cancer research and an opportunity for discussion of that research. So the first webinar was Scientific Writing Best Practices in Public Health, and we had that webinar in May. And it was very successful, and it's recorded and available online to the APHA community. And then we also are planning our second webinar, which is going to be in November, after the busyness of the American Public Health Association annual meeting. That's going to include 3 example cancer epidemiology research talks from 3 different leaders from the field, who are going to provide an overview of their field of research and then also give examples of their research. Again, providing an opportunity for discussion on these different areas. We have plans to continue that work next year, and we will be developing new goals, building on our successes for this first year.
Wonderful, exciting projects. How do you manage your editorial roles with the Michigan Journal of Public Health and the Journal of the National Cancer Institute, while also balancing your teaching and research?
So those are two roles that are very important to me. They are a really, as I've grown in my career, I've been looking for service roles that also provide me the opportunity to share my scientific expertise. And so when I have a role in service that is also using my scientific expertise, it's a really good fit for me. The Michigan Journal of Public Health role as editor of that journal is I'm very excited about. We also are using that journal to promote education and best practices in public health dissemination and scientific writing. And I will be presenting at the American Public Health Association on lessons learned in rebuilding and revitalizing the Michigan Journal of Public Health this year. I want to give credit to the Michigan Public Health Association, which supports the Michigan Journal of Public Health and has helped support building a new editorial board of established scientists from across the state who provide support and peer review. We are, though, completely volunteer run, and we're excited for our first issue in December. For the Journal of the National Cancer Institute, that is a high quality, high impact journal. And the journal, I have been in that role since 2015, and it is an opportunity to contribute to leading national science in cancer. What I like about the Journal of the National Cancer Institute is they are committed to initiatives that are really important. So, for example, they have developed a diversity, equity, and inclusion policy that is very thoughtful and comprehensive, and I really think that's well done. They also are offering early career opportunities for early career scientists to be mentored to publish in the journal and provide an opportunity for those scientists that are maybe they're new to publishing in the Journal of the National Cancer Institute. And I think those are really important initiatives and opportunities. So I really value that role.
Wonderful. Sounds like great opportunities. And I think you mentioned a bit of next question. What are some of the emerging areas in epidemiology and public health research that you are excited about and plan to focus on in the coming future?
So I think one area that I'm focusing on is on maternal substance use and substance use disorders in Michigan. This is building on my work in Tennessee when I was lead scientist for work related to the opioid epidemic. And I've been bringing some of that work to Michigan. And so this is very new, but we are presenting some descriptive epidemiology findings at the American Public Health Association. And this is really looking at trends and patterns and characteristics of maternal substance use in Michigan by county and also by comorbidities, including mental health outcomes. And then the goal is to use those results to have meetings with local health departments as well as community-based organizations in Michigan to use those results to inform education opportunities and interventions, but also have the community members inform us in regards to additional analyses that would be helpful to see, as well as limitations of the data. As an epidemiologist, a lot of times you're spending your days doing data analyses in data and you're not thinking so much about what the results mean or how to improve the results. You're using these secondary data sources that are wonderful because they're available and they're reasonable, but they have methodological issues. They are missing information. And so getting insights on how to improve those data sources is really important. And so that is the goal for that research. I also, in the area of cancer research, have a role as guest editor for a upcoming issue that will be released in probably 2026. So it's still a ways off, but it's building on my research in cancer survivorship. There's been a lot of work in the role of lifestyle and modifiable factors in cancer survivorship, quality of life, but less work focused on mental health of cancer survivorship and also the role in interaction with social determinants of health in underserved populations. And that is the focus of that next research.
Sounds great. Dr. Sarah Nechuta, your insights and experiences have been incredibly valuable, and I truly appreciate you sharing your knowledge. Your dedication to advancing public health is evident, and I look forward to seeing the impact of your future projects. We wish you much success in the coming APHA 2024 annual meeting. Thank you.
Thank you so much for having me.